Okay, let's talk about something huge. We are right on the edge of a personal health revolution. I'm talking about a totally new way to understand and manage our own wellness, and it's all being driven by AI. For most of us, navigating healthcare feels like trying to solve a puzzle with half the pieces missing, right? Your information is all over the place, patient portals, different apps, scribbled doctor's notes. It's almost impossible to see the big picture. And it's exactly that frustration that has pushed millions of people to find help from a very powerful, though maybe unexpected source. Take a look at this number, 230 million. That's how many people every single week are asking ChatGPT questions about their health and wellness. This isn't some prediction about the future. No, this is a massive global behavior that's happening right now. And if we zoom in on the US, that number is still staggering, 40 million adults. These aren't just casual searches. People are actively looking for tools that can help them understand symptoms, decode medical jargon, and make sense of their treatment options. It just goes to show you there's a huge unmet need out there. And this is where it gets really interesting. This trend is even more pronounced where healthcare is hard to come by. Every week, 600,000 of these health-related messages are coming from people in underserved rural areas. This really shines a light on a critical gap in our healthcare system, a gap that technology is starting to bridge. So, in response to this incredibly clear, global demand, something new has been built. It's called ChatGPT Health. And it's not just a feature. It's a specialized tool designed from the ground up to be a dedicated companion for your personal health journey. Now, let's be really clear about what this is and what it isn't. The goal here is absolutely not to replace your doctor. It's all about empowering you. The idea is to securely bring all your health data together into one smart place so you can walk into your appointments feeling way more prepared, better informed, and just more confident about taking charge of your own health. All right, but as soon as we start talking about putting all our health information in one place, one thing immediately comes to mind: privacy. And you're right, for any of this to work, for anyone to trust it, security and user control have to be the absolute foundation. It's non-negotiable. And here's how they're handling that. It's all about separation. Think of it like this. Your health information doesn't just get thrown in with your other chats. No way. It lives in its own dedicated, totally isolated space, a separate vault. It has its own memory, its own layered encryption, and this is the most important part. Your health data is never used to train their models. It's locked down. And that control extends to how you connect your info in the first place. You're completely in the driver's seat. You can link your medical records through secure, trusted networks. If you want to connect a wellness app, it only happens with your explicit permission. And it's not a free-for-all. Every single app has to pass a tough security review. And of course, you can pull the plug and disconnect any of them anytime you want. Okay, so that's the security part. But what does this actually do? Let's get into the exciting stuff. How this thing takes all those scattered data points from your records and your apps and turns them into something you can actually use, a clear picture of your health. This quote from OpenAI's head of applications, Fijisimo, is just a perfect example of the power here. She asked if a certain antibiotic was okay for her, and because the system had her medical history, it flagged a major risk that this specific drug could reactivate a serious infection she'd had years ago. I mean, that's the kind of critical insight that can easily get missed when a doctor is rushing and only has a few minutes to glance at your chart. Or think about your lab results. You could ask something simple like, how's my cholesterol trending over the last year? And instead of just getting a single number from your last test, it can actually show you the trend. It turns all that raw data into a narrative, a story about your health that you can actually follow and do something about. It can also be your personal prep assistant before a doctor's visit. You can tell it, hey, summarize my latest blood work and make me a list of questions for my appointment tomorrow. It'll translate all that confusing medical jargon into plain English and pinpoint the key things you should probably bring up. It just helps you make every minute with your doctor count. And its usefulness goes beyond just the clinical stuff. It can even help with the financial headache of healthcare. You could give it a couple of insurance plans you're considering, and it'll create a simple pros and cons table based specifically on your health history and what you're likely to need. That's a super practical, personalized comparison. But here's a really crucial piece of the puzzle. It's designed to connect to the whole ecosystem of health and wellness apps that so many of us already use. We're talking Apple Health, MyFitnessPal, Peloton, you name it. It brings all that fitness, nutrition, and lifestyle data into the very same conversation as your official medical records. And this is where the real magic happens. It's all about connecting the dots. When you have your steps from one app and your sleep data from another, you can start asking really interesting things, like how do my daily steps correlate with how well I sleep? It can find those connections for you, uncovering patterns in your own health that were pretty much invisible before.
Okay, so let's zoom out for a second. A tool this powerful doesn't just change our personal habits. It has the potential to really shake up the entire healthcare landscape.
The potential here is truly systemic. Think about it. It could help close those care gaps for people in rural areas we talked about. It could help us finally shift from a system of reactive sick care to proactive health care. It could even help clinicians by cutting down on their burnout-inducing paperwork. And at the end of the day, it empowers all of us to be more active partners in our own health. Of course, a massive leap forward like this also brings some serious challenges to the table. We have to think hard about things like who can actually decrypt and see this data, and under what circumstances. We have to consider the impact on smaller digital health startups and figure out the right regulatory path for these kinds of consumer AI tools. And there's always the relentless challenge of making sure the security can keep up with the incredible sensitivity of the data. So here's the bottom line. When we can finally centralize all our scattered health data and actually make sense of it, we gain an incredibly powerful new way to understand ourselves. This is about more than just a clever AI companion. This is about a whole new era of personal health management, one where the power of insight is, at last, placed directly into our own hands.